J'ai maintenant un grand plaisir de votre présenter de notre premier intervenant qui représente l'un de nos plus importants partenaires, le gouvernement du Canada. Elizabeth Toller est sous-ministre déléguée à la Santé à Santé Canada. Elle dirige certaines des plus importantes priorités nationales en matière de santé, dont la modernisation du système de santé, la transformation numérique et l'innovation. Throughout her career, Ms. Toller has been a strong advocate for collaboration across governments, partners, and sectors, recognizing that the future of healthcare depends on our ability to securely connect data, harness innovation, and enable better decision-making for both care and policy. As Canada advocates its vision for connected care and as artificial intelligence and data-driven innovation reshape health systems around the world, Ms. Toller's leadership continues to help position Canada at the forefront of this transformation, building a health system that is not only more connected and efficient, but also more sustainable and patient-centered. We are honored to have her with us today to open the 2025 Partnership Conference and to share Canada's perspective on the value of health data, interoperability, innovation for the economy, and for the health of our citizens. Joignez-vous à moi pour accueillir Madame Toller sur scène.
Hi, everyone. Thank you so much, Peter, for that very warm welcome. It's really an honor to be here. I've sort of made a joke to a few people that I think I'm Plan D for the keynote. I think many people were hoping to hear from my minister, the Honourable Marjorie Michel, or perhaps my deputy minister or my assistant deputy minister. You're stuck with me, but I promise to try to make the next 20 minutes worth your while. Before I get started, I do want to recognize that the land on which I live, work, and play is known today as Ottawa. It's from the traditional unceded territory of the Algonquin and Anishinaabe people. And I really do recognize that the privileges that me and my family benefit from today are the direct result of the sacrifices and the stewardship of the original caretakers of that land. And that colonialism and its implications for Indigenous people is not just something of the past, but something that continues to affect them today, especially in healthcare. And so this land acknowledgement is just one small step in my commitment to ongoing learning and learning about Indigenous reconciliation. So I want to start off by just asking a few questions. How is it that today we have Alexa and Hey Google that can tell me the weather on the other part of the world, but when I go to see my primary care doctor that's sitting right next to me, they might not know that I recently went to the ER? How is it that my boarding pass is on my phone, that I can go to the bank and do everything online, but my physicians are still using a fax machine for my prescriptions? How is that still happening in 2025? We live in a digital age. We tap our phones to make purchases, stream movies on demand, and let AI suggest the fastest route for us to get home. And yet, our health data remains fragmented, trapped in systems that haven't kept pace, offering none of the conveniences or insights that define the rest of our digital lives. Oops. Go back one. Le Canada est à un tournant. Si on continue sur la même voie, le système va rester sous pression. Des millions de Canadiens n'ont pas accès aux soins. Les temps d'attente et les fermetures d'urgence augmentent. Et les médecins sont épuisés comme jamais. Un gros défi, c'est la fragmentation des données de santé dans des systèmes numériques qui ne se parlent pas. Ce manque d'accès à des données connectées alourdit la tâche des professionnels de santé, limite l'impact de l'IA et crée des biais, surtout pour les populations mal desservies. Mais le plus important, c'est que quand les données ne peuvent pas se connecter, on perd plus que des infos. On met en jeu la sécurité des personnes que notre système est censé protéger. We all have stories about times when our care didn't connect the way it should. Whether it's a referral being delayed because a fax seemed to have just disappeared into thin air. A time when we had to tell our story over and over again to the new providers that we see, or when we're worried that we might have left something out that was important in that story. And frankly, we probably did. Or having to undergo duplicate tests because the original test results were in a system inaccessible to our new provider. And some of us also carry the hardest stories, like a physician who shared with us that their ER patient died because of a lack of access to key information to inform the physician's emergency intervention. I know everyone in this room has a story to tell about disconnected care. And for me, it's these stories that drive home the point that luck, good or bad, and chance, these are not the foundation to a good health system. Data is the foundation to a strong health system. The good news is we're not continuing down this road. We're on our way to a different path, thanks to the hard work that each and every one of you in this room is doing, day in and day out, to drive towards connected care. I want to pause and tell a little story that when I showed my 10-year-old daughter the presentation I was making this morning, she said, "Mommy, is that you on the screen?" I laughed and said, "No, Marika, it's just a stock image of a woman, going into a portal into another world." And for us here today, that world is one where we start treating health data like it's Canada's greatest untapped resource. If we unlock it securely and responsibly, we can transform patient care, empower our workforce, and fuel innovation. In healthcare, and in Canada, healthcare generates billions of data points every day. And our universal health system yields high-quality, rich data sets. But it doesn't help to be data-rich and information-poor. If we can't connect health data, then we can't use health data to better healthcare in Canada. Nor can we effectively use it to fuel responsible AI for smarter decisions, faster diagnoses, and a healthier future for all. Imagine un Canada où tes soins de santé, mes soins de santé, ceux de tous les Canadiens, sont plus intelligents, plus rapides et plus personnalisés. C'est ça la promesse des données de santé et de l'intelligence artificielle. L'IA peut aider des professionnels de la santé à passer moins de temps sur la paperasse et plus de temps avec leurs patients. Elle peut accélérer les essais cliniques, repérer les premiers signes de maladie et détecter les menaces pour la santé publique avant qu'elles se propagent. L'IA peut même ouvrir la porte à de nouvelles avancées en innovation médicale et en croissance économique. Patient safety will always come first. It's our foundation. But when we harness health data and AI responsibly, we don't just protect people's lives, we also unlock new opportunities that strengthen our economy and fuel innovation. AI can fuel a thriving innovation ecosystem, create high-value jobs, and position Canada as a global leader in responsible, people-centered AI. With our rich health data, we have a unique opportunity to build world-leading AI applications, attract global talent, and strengthen domestic biomanufacturing and clinical trials. Healthcare is so often framed as just a cost. But with health data and AI, it can be one of Canada's most powerful economic drivers. AI could yield billions in annual savings, unlock billions in new value. But here's the truth. AI is only as strong as the data that fuels it. If we want AI to change healthcare in Canada, our data has to be able to move safely, easily, and where it is needed. And how do we get there? We need to treat health data as what it truly is, a strategic, sovereign national asset, as critical to Canada's future as energy and transportation. Health AI as an engine for the Canadian economy is not a dream. It's not wishful thinking. It is a real possibility. And we know this because other countries are already doing it. And frankly, they're doing it better than us. The United States, Australia, and many countries throughout the European Union have used national legislation and common standards to build their health data foundations. The EU, UK, and US are investing billions in sovereign health data infrastructure and in AI. Not because it's trendy, not because it's convenient, but because they understand that leadership in this space will shape the societies and the economies of tomorrow. Nos partenaires internationaux avancent vite, mais il n'est pas trop tard pour se joindre à eux. On a été des pionniers avec notre stratégie nationale en IA en 2017. Et aujourd'hui, on a la chance de montrer encore une fois ce que c'est un leadership audacieux. Le Canada a tout ce qu'il faut pour être en tête. Une communauté de recherche de calibre mondial, un écosystème en croissance de start-up et de PME, des systèmes de santé publics solides et certaines des données de santé les plus riches et diversifiées au monde. C'est le moment de saisir notre chance. The federal government has set out a bold, Canada-strong vision, a vision of nation-building projects that knit this country together, driving one Canadian economy, breaking down barriers, building infrastructure, mobilizing AI at scale, and investing in healthcare. And here's what's remarkable. That vision doesn't just relate to our vision in the health sector here in this room. It actually amplifies it. In fact, it creates the conditions that we need for our vision to truly come to life by connecting health data and breaking down the barriers to sharing, building the digital and physical infrastructure, foundations with common standards, sovereign compute infrastructure, and modern healthcare infrastructure, including in the North. Harnessing health AI to the benefit of patients and providers, but also to the benefit of one Canadian economy. And to this, that for the first time, Canada actually has a Minister of Artificial Intelligence and Digital Innovation, the Honourable Evan Solomon. Mr. Solomon is leading work on a new pan-Canadian AI strategy to renew thinking on how to harness innovation, achieve our AI ambitions, and secure digital sovereignty. This moment isn't just aligned with our priorities, it's inviting us to lead. Dans le cadre de la récente consultation sur la stratégie de l'IA, Santé Canada a regroupé les conseils et les recommandations reçues des partenaires du secteur de la santé. Les intervenants ne parlaient pas de l'IA en santé comme d'un détail ou d'un sujet marginal. Ils demandaient que l'IA en santé joue un rôle central dans la prochaine stratégie canadienne de l'IA, parce qu'ils savent que c'est là que l'IA que l'IA peut offrir les plus grands bénéfices pour les patients, les plus grands biens publics et le meilleur retour économique. Another message that came through loud and clear. Health data must be treated as critical infrastructure, not just an IT asset or just a byproduct of care, but a national foundation that demands secure, interoperable, AI-ready systems if we want to unlock real innovation. We also heard what's missing: policies and legislation that match the moment we're in, modernized rules for privacy, for AI safety, and for sharing data responsibly and confidently across the country. Stakeholders were clear on this point as well. Pan-Canadian governance built with the people that it affects: Indigenous partners, patients, clinicians, and communities is equally as important. Put this all together, and a clear picture emerges. This is a blueprint: common standards, clear data sharing rules, innovation, enablement, partnership, and trust. These aren't just abstract concepts. They're what Canadians told us they need for health AI to be safe, to be effective, and to have meaningful impact. Quand je regarde autour de cette salle, je suis frappée par la force des personnes incroyables comme vous et par la puissance des partenariats et des collaborations qui font avancer les choses. Gouvernement, industrie, fournisseurs, patients, tout le monde a contribué à ce parcours. Together, we have achieved a lot of remarkable things. We have a federal, provincial, territorial action plan on health data and digital health that is helping to align digital health priorities from coast to coast to coast. Canada Health Infoway's Pan-Canadian Interoperability Roadmap is turning standards into action, like the Canadian Patient Summary rolling out across the country. The Canadian Institute of Health Information's about to be released Health Data Stewardship Framework will lay the groundwork needed to slowly but surely shift our culture away from one of fear around privacy to a culture of trust and responsible data sharing while keeping privacy protection at the heart of everything that we do. Our Pan-Canadian AI for Health guiding principles are helping to make AI for health more ethical, transparent, and accountable. And as Michael spoke about this morning, we have nearly 10,000 primary care providers that are already using AI scribes thanks to the amazing program that Infoway has launched, which is proof of innovation in action. And these are just a few examples of what's been accomplished. But while there is much to celebrate, there is still a lot of work to be done. And Canadians are counting on us to keep moving that momentum forward. I think our mission is twofold. Building on our achievements, we need to use health data and AI to transform healthcare urgently, giving Canadians safer care, better access, and the power to use their own health data. And we must drive growth and innovation, unlocking new value, creating new opportunities and new jobs, and building a stronger health system. So with these priorities in mind, the question to me is simple. How do we move forward together? First, scale what works. Proven solutions need to grow, and they need to grow fast. Second, close the infrastructure gaps. While scaling, we must invest in secure, interoperable infrastructure. These first two are not sequential. They must happen simultaneously. Third, measure what matters. Focus on outcomes, patient experience, system efficiency, and the well-being of our workforce. And fourth, build trust. Success depends on patients and providers knowing that we are responsible stewards of their data and that AI is ethical, transparent, and accountable. Quand on combine ces 4 étapes, élargir, bâtir, mesurer, faire confiance, on ne fait pas juste améliorer les soins de santé, on les transforme pour chaque Canadien, pour notre économie, pour notre pays. So as I wrap up, I want to bring us back to the heart of why we're here, the patient experience. As we move through the conference, I'd like all of you to think about someone in particular. Maybe it's your parent, it's a neighbor, a friend, whose care has suffered because their data didn't connect in the way that they should. Or maybe it's the story that Harjeet told us just this morning, who used digital tools to find the connection that she needed. For me, it's my mom, who lives at the border of Ottawa and Gatineau, and as she ages and her care becomes more complex, connected care becomes all the more important. And I challenge us all to think in concrete terms about how these 4 steps, scaling, building, measuring, and trust, could transform care so that the convenience and insights of health data and AI are woven into patient journeys as seamlessly as checking the weather. Thank you.